name is Byron Ellis, and this is my presentation on why we need better sexual education in schools in America, specifically. So why do we need sex ed? Lack of sex ed can lead to very negative outcomes for young teens, such as high rates of teen pregnancies, transmissions of STIs and STDs. Those that can be very serious are HIV, which could even lead to death. This is a very serious issue. Also, just teaching young people about the importance of safe sex will decrease these rates and allow people to live happier, healthier lives, because young teens make up half of the STI and STD rates in America. So this is clearly an issue with the youth. It needs to be addressed. So what is sex ed? So sex ed is high quality teaching about a broad variety of topics related to sex and sexuality that allow children and young people to make conscious, satisfying, healthy decisions regarding sexual relationships, intimacy, and physical health as well. Because having this course in schools will allow kids to make better choices and be healthier, because right now there's a disparity where children in poor communities or in communities that don't stress sexual education don't really get it, and they get these negative outcomes, as I mentioned earlier. So currently, the United States has the highest teen pregnancy rate among most industrialized countries, and this is probably due to not only lack of sexual education, but this push for abstinence, which I'll get into in the next few slides. So how do these negative outcomes from lack of sex ed / abstinence, how do these negatively affect different communities? So this can negatively affect the teens that identify as a part of the LGBTQ communities, because there are lack of, even if there is sex ed, there's lack of sex ed courses that fit the needs of LGBTQ teens, so they don't get that knowledge that they would need. And the data supports this, because LGBTQ teens have a higher rate of getting, or higher risk of getting these STIs and STDs amongst other groups. So this is important. These negative outcomes can also affect children in the Black communities, specifically because children in the Black community are constantly force-fed this abstinence related sex ed, or no sex ed at all. And we can see, if you can see this chart here, that children in the Black community have a really high rate of teen pregnancy, right behind their Hispanic counterparts. So clearly this abstinence sex ed isn't working, so we need to take a new approach. And other relevant factors here that can sort of affect children or teens' desire or need to use contraceptions or things like condoms, things like that, can be maybe embarrassment. They don't really know or have never really been taught how to address their own sexuality, so they may be afraid to talk about it, and maybe that means going out and buying condoms or contraceptives might just be an embarrassing process for them, because it's never really been normalized in their lives. And others can just be simply lack of knowledge and no emphasis in their lives on things like this, because of this idea that abstinence is the way to go. And I'm going to get into my Q&A here. So why do Black communities suffer more heavily from this issue? Well, I think that the Black community suffers more from this issue because the Black community is a poor community, so they're less likely to get the good education. The poor communities don't get good education in general, so it's less likely that they're going to get good sex education on top of that. So this is a reason why you see the higher rates of teen pregnancies. And why is there such a push for abstinence, even if it has been proven to be less effective? And I think this is a bunch of social issues combining into one, because parents and the government, it's a scary thing to talk about children having sex, because there's a negative stigma behind this idea of promiscuity. So if we normalize sex, people are going to think, oh, all the children are going to be promiscuous, and it scares people. And there's also kind of this underlying belief of with the abstinence, is with the Christian belief, where abstinence or sex is a sin and sex is bad, and parents and people don't really know where to put it. So it kind of just is kind of just thrown as, well, sex is bad, just don't do it. And you can see that this doesn't work from the data, because you see the increases in the STIs, STDs, and also the teen pregnancies. So this method leads to negative outcomes across all groups. And that's my presentation. Thank you for watching. I hope that this was helpful.